Hi, this is Dana and Denise.
Hi.
With the PT moment.
So it's Friday, so we're a little punchy today. But this was our first video that we're going to do for you guys for the PT moment. We just want to teach you a little bit more about what we do. And actually, I'm super excited about this one because Dana's going to take us through a balance assessment. I have never been taken through a balance assessment. I have never seen Dana do one. So I'm super excited to do this with her so I can learn a little bit more about maybe there's some patients I should be sending her. And just to learn a little bit more. So
Sure. And so a balance assessment is something that I do on all of my patients that come in, whether they have a vestibular diagnosis or an ankle sprain or knee pain. I look at this on pretty much everybody. And what we'll do today is just part of a balance assessment because a full one will take way too long.
Okay. And I haven't been drinking, so I hope that doesn't throw it off too much.
It might be better.
Okay.
Okay, I think we're good. So when I look at balance, I always tell people there are three things that make up balance. And you need good input from your eyes, you need good vestibular input from the inner ear, and then you also need good somatosensory input from the receptors in your muscles and joints. And
Does that mean like my body knows where I am in space?
Exactly,
Okay.
Exactly. So if there's something off with any of those systems, whether you wear glasses or if you have an ear infection or something more significant like an ankle sprain or a vestibular diagnosis, then there can be a problem in any of those systems and throw off your balance.
Okay.
Okay, so what we do first is stand with your feet together, arms crossed, and keep your eyes open. And what we're looking for here is how much you sway. If you're nice and steady or if you kind of wobble around, and you look nice and steady here. We would hold this for about 30 seconds and just see how you do with it.
Okay.
Okay. Moving on from here, the next step is to close your eyes. And so when we do this, we're really relying heavily on that input from all the muscles and joints telling your brain where you're at in space. It is more normal to sway here.
I feel a little bit of a sway, but not bad.
And that's normal. So anything abnormal would be if you completely lost your balance and came out of that position.
Okay.
Okay? The next thing that we look at is trying to change or take away that accurate input that your joints and muscles give you. So we use foam for that. And what you're going to do is stand on the foam with your feet close together again.
Both feet?
Both feet.
Okay.
Touching, and then your arms crossed here.
Now, do you normally have patients do this with shoes on, shoes off?
Usually we'll take their shoes off.
Oh, okay.
Yeah, you get special treatment today.
Thanks.
So here, it will be normal to see even a little bit more sway. You're relying in this position very heavily on visual input from the eyes, as well as a little bit of vestibular input from the inner ear.
Okay.
Okay? And again, we hold this for about 30 seconds.
Okay.
Then I have you close your eyes. And in this position here, we've taken away somatosensory input from the body. We've taken away visual input. Most of us are very visually dominant to keep our balance. And we're relying on the vestibular component of our balance. And here's where we typically see the most sway. If you have a vestibular problem, most people will fall off of this pretty much immediately.
So when you say a vestibular problem, can you explain what that means?
Absolutely. So if you have vertigo, if you have had repeated inner ear infections and there's damage to the nerve, if you have something wrong in the brain that challenges your balance, like MS or Parkinson's, then this would be a position where we would see the most difficulty.
Okay. All right.
Okay.
So now, I see a ton of runners.
Right.
Who, when I put them with one leg up, one leg down in the running position, they sometimes can't even hold that. And so I could do a modified version of this, which I do. I'll sometimes just have them stand on one leg. I can see it when they're running, but I think during their assessments, I very rarely add something under their feet. I'll do that later on during treatment, but I didn't even think about just doing this super quick to really test.
Right. And especially because a lot of our runners run on outdoor surfaces.
Yeah, our trail runners.
Yeah. And so
I'll do it every time with my trail runners, but I forget to just mix it up to see if maybe there's a vestibular issue for some of my runners too, maybe.
Sure.
So. Okay, cool. And then what about, I know you see some elderly patients too.
Correct.
Do you and the neurologist talk about the findings that you find during this? How do you communicate with doctors about their
Sure.
balance issues?
Yeah, so every time I see a patient, I will send a very detailed report of everything that we tested, and not only what we tested in the findings, but the implications as to how that relates to real life. For example, if someone can't keep their balance on here, on the foam with their eyes closed, they might have a higher risk of losing their balance or falling when they're walking on a soft surface at night. So
All right.
that would be a higher fall risk for somebody.
Okay.
So I try and communicate that with the patient and the doctor also. And then if there's major red flags, if their balance or if it's very abnormal, I would contact the doctor also and discuss it.
Okay. Well, so I hope you guys learned something today. If you have any other questions for Dana about balance assessment, and you will actually, wait, sorry, real quick. You also do this with when you're doing concussion screening on 12 and under and then 12 and
I
above,
will do this on everybody. Yes.
Okay. So how do you use that when you're looking at pre and post concussion? Why would you have to gather this data on an athlete?
After a concussion, one of the main symptoms after a concussion is difficulty with balance. And so in order for someone to be able to return to their sport, they need to have good agility, they need to have good balance, they need to be able to move quickly and safely. And if their balance is off, then they're not okay to do that.
So that's why you take their balance assessment prior to them starting the sport, so that you have that on file.
Right.
All right.
Exactly.
Well, great. Well, if you guys have any questions, shoot us a message.
Absolutely. We'd love to hear from you.
And what's our next video going to be on? Are we going to do the Frenzel goggles stuff?
I think we might go look at the vestibular stuff.
All right. So again, there's so much I don't even know about what Dana does with some of this inner ear dysfunction. So I think you're going to be doing some small videos on our Facebook page about understanding the vestibular system.
Exactly, yes.
But she uses these goggles. They're Frenzel goggles. They remind me of like those drinking goggles that
Everyone calls them the beer goggles.
Yeah. So super excited to see those too. Well, thanks. Thanks for taking us through that.
You did great.
All right. Thanks. Good balance. All right. All right. We'll see you guys next time.
Bye.